So welcome to the fifth talk of the second season of Tiny Lab Talks. Tiny Lab Talks are informal 30-minute conversations with invited American specialists visiting the University of Aveiro, promoted by the University of Aveiro American Corner, to share knowledge in an accessible and engaging way. The talks are live streamed on the University of Aveiro's YouTube channel. I'm Filipa Oliveira, an integrated member of RISE Health in the Department of Education and Psychology at the University of Aveiro, and also a PhD candidate in psychology at the interface of neuropsychology, e-health and psycho-oncology, and it's a pleasure to moderate today's discussion. I want to give a warm welcome to both our guests today, Dr. Linda Ercoli and also to Dr. João Santos. Dr. Linda Ercoli is a retired health sciences clinical professor in the Department of Psychiatry and Behavioral Sciences in the Semel Institute at the University of California, Los Angeles. She is a geriatric neuropsychologist and psychologist with special interests in the early detection of dementia, late onset depression, dementia caregiver stress and education, and the creation of cognitive training and rehabilitation programs for older adults and cancer survivors. She has been the interim director of the UCLA Longevity Center since 2020, a campus-based non-profit organization dedicated to wellness, brain health, and lifelong learning for older adults. She is currently recalled faculty at UCLA, continuing her work at the Longevity Center in caregiver support and as a consultant for clinical trials. Dr. João Santos is a researcher at RISE Health at the Department of Education and Psychology of the University of Aveiro. She holds a PhD in gerontology and geriatrics on elder abuse and conducted research at the National Institute of Health, focusing on population-based studies on older adults and preventive health behaviors. Her research interests include violence against older adults, social determinants of health, and health literacy. And she is currently involved in European projects focusing on cancer primary prevention and cancer literacy, namely the projects for PCAN and CURTIN. So, first of all, thank you both for joining us today. The topic of our talk is the importance of health literacy in dementia and cancer. And over the next 30 minutes, we will focus on how health literacy affects prevention, diagnosis, care, and rehabilitation in dementia and cancer, and on practical strategies to improve literacy for patients, caregivers, professionals, and also the general public. So I will start with my first question to both of you. So you work both in the aging field, and my first question is, what is the importance of health literacy in cancer and dementia, and what that entails for older adults who are navigating risks for both conditions?
So I'll start. I would say that one of the importance of when we look into older adults, they have usually lower levels of health literacy. So these lower levels of health literacy are associated with worse outcomes in a lot of different chronic conditions and health conditions. I would say that even though it is expected that in dementia, the low literacy level of the patient would become less significant throughout the progression of the disease. Both in cancer and in dementia, the importance is not only to promote levels of adequate literacy previously to the occurrence of this condition, but also focus on the caregiving and the informal family and social network, because we know that older adults often delegate these health-seeking information, health decisions to the informal caregiver, for the family, the social network that is supporting them. So we should also focus on enhancing health literacy within the caregiver, within the family, within this system, in order to guarantee that adequate, reliable information that is understood by the patient and the family navigating these two conditions can be actually appraised and used and applied.
Thank you. For health literacy, you think about not just the knowledge, but also accessing the information and knowing how to apply it, right, in order to benefit from having that knowledge. And I guess one issue is that people don't worry about it until they have to deal with it. And both cancer and dementia, we know, are to some degree preventable. Either through healthy lifestyle habits and risk reduction. So some people will get dementia regardless, but there's a possibility to put that off much longer, right, until later in life. So one very important area of health literacy is knowing how to reduce one's risk for dementia and also cancer. And so that's number one. Number two is absolutely, Doctora, it is true that much of this falls upon the caregivers, especially in dementia, because early in the progress, especially of a neurodegenerative dementia that gets worse with time, the patient is no longer able to make decisions, right? They are no longer able to process the information and make good decisions. So this is where the caregivers have to step in. But one issue with that is for the caregivers to be able to get the knowledge. And often there is fear associated with knowing about dementia, especially the end stages, which can be of course, can be very brutal and debilitating and sad. But yet the caregivers need the information relatively early. They don't have to know everything early, but they need to know where to go, where to get the resources, and what are the important steps for intervening and assisting the patient along the way, and to make their job as caregivers easier. Because much of the burden with dementia is our behavior problems that occur in the patient. So they may be physically well, depending on the type of dementia that they have, or they may not be. But definitely they will have personality changes. Sometimes they're very difficult to deal with. And the caregivers take this very personally, and so it's a big contributor to the caregiver burden and to people in the United States placing their loved one in a residential care facility. So back to health literacy, it is very important for the caregiver to really understand the nature of dementia, what types of personality changes happen, so that they can have less perceived burden associated with the job of being the caregiver.
Okay. And what do you think are the main challenges caregivers face when they try to have more information about the condition of their loved ones?
In cancer or in dementia?
In dementia, in this case.
In dementia, there is a lot of information out there, but it's accessing it. So number one is, do you have access to resources? And usually there's a lot on the internet, but there's almost too much, because the caregiver has trouble finding the right information at the right time that's going to prepare them and educate them for where they need to be right now, and then where they may need to be a year from now. So one is accessing it. Another is, besides accessing it, is who accesses it. So these are issues that come up when there are health disparities, when people are in communities that don't have a lot of word of mouth, when people are in communities that suffer from discrimination, or they don't experience good person-centered care, where the team of physicians or social workers or psychologists really talk to people on a one-to-one level, so they really know what they need to do, what kind of information they need. And this seems to be a greater obstacle to getting this kind of help in communities that have either, as you were saying, lower education, or in communities where there's discrimination. So that is probably the two, or those are probably the two main points, is how do you access the right information at the right time.
And what about cancer? What is your perspective about this point?
I would say that that is quite similar. What we know about health literacy is, and health literacy applied to specific conditions, is that it usually dependent on the same socio-demographic factors. It's really a social determinant. Is based on social context, namely education, income, age, urbanicity, or people living and residing in more urban or rural places. So throughout, and even looking at the different types of diseases, we know that these type of so people within lower socioeconomic status tend to have lower health literacy, and usually are the same people that live in places where they have lower access to information on health information in general. But the question about the cancer and where to access information, how to process information, is similar. Specifically because nowadays we have a lot of digital electronic sources, and a lot of health information is available, sometimes only available throughout the internet and other types of platforms, even used by the organizations that provide care. And if we think about people that may have difficulty actually accessing and then using the platforms, or knowing which sources to trust, I would say that access is the first one, because you can have a very great guide, resources, or information, booklet or pamphlet, but if you do not make sure that it gets to everybody, or the people that you want to try to get, it's not that useful. So I think even though we are growing as a population throughout the world that will use and only rely mainly on electronic sources, we still have a large part of the population that doesn't. So I would say that access is the first. And again, the problem with access is distinguishing between sources and channels and so on. I think that is something that has to be taught. I don't think that necessarily what the data tells us is that there isn't necessarily inherent trustworthiness in terms of sources, especially if we look into the mis and disinformation climate we live in. So I would say that it's actually very similar and very straightforward. It's, I think, either for cancer or dementia.
And nowadays I think both in the US and also in Portugal, we have the influencers, right? So what do you think is the main role of these persons right now in our world?
Okay, I'll take a stab at this one. They have great potential to be helpful, I think, especially in reaching maybe the younger generations who utilize social media. So that could be a good thing. That's another point of access. The other issue is, what are they selling, right? And how reliable is the information? What is the intention of that influencer? So there are definitely influencers that are there purely to educate people, especially educate people that this is the way that people get their news. Might be through TikTok or whatever platform is being used. But my concern is the quality of the information, what the influencer wants to get out of this, which we can only they can only know in their heart, and also the difficulty that the public has in knowing good information from bad information or misinformation. And this let the consumer, as they say, or let the buyer beware that this is a problem that we have with the basic consumer because of maybe a general lack of health literacy or a lack of medical knowledge and not knowing how to verify whether what somebody is saying is true. So there's definitely the influencer may come off as an expert in telling the truth, but we don't know that that's going to be the case.
I would add another perspective that is, I agree. I don't think we general public has the skills to understand communication techniques when somebody is selling us anything. I don't think we have that. But I would say that I think that the research organizations, governments, national health institutes and so on that produce scientific information now need to have their own influencers. And I think we cannot keep on the bubble and say, okay, I do research, I do very rigorous research, and this is what the data shows, if nobody's going to look into the data or understand the data.
How do we translate it to the society?
Yeah, and I think because sometimes in research worlds we do things we are very correct in the way we do it. We think that is enough, and I don't think that is enough. I'm not saying that is the job of researchers per se, but I think these organizations have the responsibility to use these platforms and to learn how to communicate with these younger generations in order to actually get the message through. The problem is not, okay, I'm going to just educate the generation to really understand which source to trust. I think the other way around there's a way they have to learn. I think it's developed these competencies.
Yes. We are here talking about chronic conditions that probably will appear in a later moment in life. But we are here also mentioning that the younger generation has an important role, right? So how can we transmit the information, convey this information to the younger generation about something that probably won't be as important for them at the moment, but probably in the future they will have to worry about probably having dementia or having a cancer diagnosis?
In terms of what we know about what works to enhance or promote health literacy, we know that the major area in cancer that has been focused is prevention and the promotion of healthy behaviors, and that is better done at very younger ages, like very young children, and that works. Educational programs work, always paired with self-efficacy strategies and techniques. People have to know not only the information, but they have to feel they are able to, because the world is changing and because we have all these platforms. So I would think that education should also be how to appraise if something is trustworthiness, the difference of information that I get from this source, which is for instance, a non-governmental international organization for cancer, or just a celebrity talking about the new detox supplement. So I think that is definitely within the school years you can actually reach that, but it's something that it cannot depend on one innovative program or pilot project. It has to be something that is continuous and repetitive throughout the years. You cannot give this to children with 9 years old and then repeat it or just once and expect this to. I think this is something that you should replicate.
Yeah, I agree that the curriculum and having more education about this in schools and in a way that will draw kids in. So people aren't going to be interested usually unless they know somebody with cancer or they know somebody with dementia. And that's how we see a lot of people get into the area of gerontology or dementia, because they've got a loved one. They have a loved one with this problem. So that's I think an entry point for them starting to educate those people who already have an interest. And I think we do have a lot of possibility in the media to educate people about this. I mean, sadly, we have had, like in the United States, but we've had world-renowned actors and figures get early onset dementia and different types of dementia. You know, actors that are heroes to kids, and this has raised the profile of this can happen to somebody like that person.
Yeah.
And so these are opportunities to inform people about this, even if they're not going to worry about it now. Yeah. The other is to teach about heart health and brain health. And that's something that starts at a very young age because we know that heart disease, which is linked to at some point with developing dementia, you know, depending on, you know, whether you have risk for stroke or low circulation of, you know, oxygen in the brain, that young people need to be working on this now. It's never too early to start, and their parents can help them do this by approaching diet, exercise, right, in a healthy way, like raising their children with this type of mindset. And I think this will set the stage for also wanting to care about brain health as much as, you know, heart health.
And what do you think can be one practical action our audience at home, probably patients, also caregivers, professionals, what can they start doing tomorrow to improve health literacy around dementia and also in cancer?
For dementia, what they can start now would be brain health and heart health. To look at lifestyle practices that lower your risk for both, because if you lower your risk for one, then you lower your risk for the other. So this would be, you know, eating diets that do not have a lot of processed food, high salt content, do not smoke, and limit alcohol. These are like very important pieces to brain health and heart health. Exercising, reducing stress, and we can always. There is no time that's too soon to implement those, yes. Right? And also, there's really no time that's too late either. Although sooner is better because there's prevention. Later, you try to slow down the damage. But early is prevention. Yeah.
I would say that the teach back is something that is really simple, and is something that can be used independent of the target group, which is for healthcare professional. I think if they can routinely add this to their interactions with patients, it makes a lot of difference, which is ask patients or family members if they can explain back to you what you just the information that you transmitted, and it can be something like just to make sure that I was clear enough. Can you tell me what our next plan is or what we're going to do next? And even for patients and family members and caregivers, actually asking the professional and explaining to them what they thought understood is really, really important, because the health professional can make sure that something is clear or not, or can correct you in that exact moment, rather than you keeping that doubt for yourself or actually misunderstanding something and then getting surprised with some result that you didn't understood correctly. So the teach back is something that is really simple and very effective and can be used throughout all the different interactions in health services and professionals.
Yes. So just to finish our conversation, I would like to be a little bit provocative and ask you in one sentence, what is the single top priority you would recommend to improve health literacy in your field?
I think the education of young people, but how to get them that information is probably the big question. So, but that would be number one, and we talked about different ways to do that. And one more, I just got to slip it in, is that our doctors that are most likely to be the first medical professionals to see these patients in their early stages of illness, that they get education about detecting dementia. And I can't speak to cancer like you can, but dementia, because there are people that go to their doctor and say, don't worry, you're just old, it's okay. And it is not okay. And those are the people that have delay of treatment and diagnosis.
I would say that include health literacy practice at the organizational level, to be something that is included in standard of care for all healthcare services and professionals, but really included as any standard of care that we use, because it becomes part of the organization and it becomes routinely thought about it. I think that really helps for patients, for caregivers, and for people, because health literacy affects not only the information they receive, but the navigating of the treatment and everything. So I think that's it.
So thank you very much,
Thank you.
both of you, for being here. Thank you for being here today and for participating in this Tiny Lab Talk.